So I'm here tonight with Dr. Justin Manning, and Dr. Manning is the Chief Member Experience Officer at PECAA. It's the eye care industry's largest and only combination buying group and alliance, serving 12,000, get that, 12,000 independent eye care professionals. He's the founder and host of the Practice Advantage podcast. Now, prior to joining PECAA, he founded the Keratoconus and Scleral Lens Institute at Bettner Vision in Colorado Springs and Eye Leader, a consulting company focused on leadership development, technology in eye care, and population health. Now, Dr. Manning contributes regularly to Review of Optometric Business. He's lectured nationally and internationally on specialty contact lens design, population health, and the patient experience, which we're going to talk a lot about today. He earned his Doctor of Optometry degree from the Ohio State University and completed a residency in geriatric optometry at the VA in Puget Sound in the healthcare system, Tacoma, Washington. You got a Master of Public Health degree also at Salus University. You're a real sucker for punishment, aren't you there? And a graduate certificate in customer experience from the Colorado University Boulder Leeds School of Business. He's driven to help all IECPs, independent eye care professionals, grow their businesses and enjoy their practices every single day. So welcome, Justin. That's impressive. And thanks for joining us today.
Thanks, Alan. Appreciate the opportunity to be with you. Didn't expect you to read the full bio, but I suppose thanks.
I did. I mean, I did cut a couple words out, but I thought it read really well. Added my own little thing in there. I didn't try and make you look worse than I could have. So you should just thank me for that.
Believe me, I appreciate that.
I have that power. But anyhow, we're really here to discuss what I think is a critically important topic for independent eye care practitioners. And I'm an independent eye care practitioner. I've been one for 30 years. And that is the patient experience. I think it would be helpful to start if you explained what exactly that means to you. What is a patient experience and why it's so important as part of your day-to-day practice operations?
Yeah, I think the patient experience is such a critical part of healthcare, but it's a critical part of business. And in my opinion, when we look at patient experience in the context of independent eye care, it really is the bridge between great clinical care that we provide as optometrists day in and day out and successful, profitable business. Because in the end, we're solving that patient's problem and they're going to pay us for the services that we provide, the products that we provide to solve their problems. And the experience, in my opinion, is really how that patient feels at every step along the journey within the practice. And so I talk a lot about the customer journey and the patient journey, and that journey starts long before they step foot in the office. So how are they feeling at each touch point that they have within your office, each person from start to finish? And in the end, if that feeling and what they ultimately experience is positive, they have a great outcome, they get their problem solved and then some. It's not just satisfaction, it's going well beyond, above and beyond patient satisfaction. And in my opinion, that is the full patient experience from start to finish. And it is super critical for day-to-day operations because, as we look at the history, Alan, as you said, you've been in independent for 30 years. I was quite literally born into independent eye care. I'm one of those generational family optometrists.
Me too.
And I think independents have always owned that patient experience space. But, again, as we look at it from an independent standpoint, the competition is getting smarter and more sophisticated in how they market to patients, how they contact patients, what they know about the people that may step foot or that they want to step foot into their offices. And so I think as independents, we have to be paying that much closer attention to that experience from start to finish.
I couldn't agree more. In my practice, there were two things I realized that were directly related to what I thought were the two pinnacles of the patient experience. Two things that would make the patient think about their experience when they got there and remember it afterwards. So, and those are critical times if you're going to hope they're going to come back. And one was that the touch and the feel of the office mirrored what they imagined it would be when they saw your website, when they learned about you from a friend. You can't really have a really beautiful, sexy website, for instance, and I'm not getting into websites too much, I'm just using this as an example. And then they walk into a office with paneled walls and shag carpet from the 70s. It has to be consistent. And that's their first experience when they walk in is, wow, this is kind of like I thought it would be. Okay, let's go to the next step. It's so far so good. And the other pinnacle for me was somebody had told me, I think this, I can't take credit for this, but I loved it, is that patients don't know where you went to school. They don't know where you graduated in your class. All they remember is if you met their needs. And in this day and age, even that's not enough. You have to hopefully exceed them and give them an experience, not just what they expected, right?
Absolutely. No, I love those two pieces because they are so critical to that patient experience. And that website is a part of that journey, and being able to see that, feel that, and experience what they saw on your website as well as when they walk through the front door is key.
Yeah, consistency. Now, it's a good month, by the way, for us to be talking about this because May is Healthy Vision Month. And since we're talking about patient experience, talk to our viewers about the role that patient experience plays in helping patients maintain healthy vision.
In my opinion, I think it's relatively simple. And as we know, as we look at health data, a good experience is good health outcomes. And better health outcomes happen when the patient has a positive, empowering, engaging, empathy-driven experience with a healthcare provider. So if we as optometrists want our patients to have healthy vision for life, that's what we do day in and day out, from vision care to the healthcare to the medical care that we provide. That experience drives whether the patient complies with all of the treatment plans that we prescribe. And we're prescribing them because, again, we want our patients to have that healthy vision for their lifetime. And again, if they have a great experience in your office, they're far more likely to come back to you for follow-up care. If you want them to come back for, again, a medical follow-up or specific treatment plans, especially a treatment that may not be covered by insurance and they need to pay cash out of pocket for it. And it's a contact lens patient. You want that patient in at least every year for a contact lens exam. We know glasses patients follow up maybe every 18 to 24 months. And the contact lens patients are a little bit more frequent, but on average, we're still not at that every 12 months that we want our patients to. So long story short, a great experience means the patient is far more likely to comply with the treatment plans that you prescribe, not recommend, but prescribe, and they're far more likely to follow up with you for their annual comprehensive care or further medical care. And that, in my opinion, is what leads to long-term healthy vision.
It makes sense. I mean, that they would comply better with a place they had a good experience with and they trusted their provider. That makes sense. Now, as a doctor, you talk a lot about the patient consumer. Let's get into that a little bit. Where did that term come from, and why is that important even?
I can't take credit for it. I heard another one of my colleagues say it at one point in time, but I've made a few enemies. It's probably a little strong, but not everybody is a fan of that term, patient consumer, especially the consumer piece. And I once heard a doctor make a really important point around, we're not crazy about consumer. We're not crazy about, even though we provide retail services, we're not crazy about retail because what we as optometrists had to do over the last 30, 40 years to prove that we are real doctors providing real, vision changing, life changing, life saving medical care. But the reality is, when we look at the individual, the person that walks through the door for any level of care, but let's say comprehensive vision care, that patient is first and foremost going to make a decision to come and see us like a consumer. They're going to do research. They're going to first have an awareness that they have a problem that needs to be addressed, but they're going to get on like they would research anything else. They're going to get on social media. They're going to use Google, and they're going to look up eye problems, blurred vision, eye doctor, and they're going to first go to your website or see your social media. And they're going to ultimately make a decision that, hey, I like this person, or I like this practice, or the way it makes me feel, and then I'm going to go in. So that's a very consumer-driven decision-making. Unless, obviously, as a caveat, it's, I can't see and there's a, real life-threatening or vision-threatening problem, and they're going to make a very medically driven decision. But in the grand scheme of a comprehensive vision care, they're going to make a consumer-based decision to come in and see you. Then they're going to come through. They're going to have all their pre-testing. They're going to have their exam. They're going to have, their eyes evaluated, their vision evaluated, contact lenses prescribed. It's a very medical experience. They're going to be thinking and operating out of the context of their healthcare and their vision care as a patient. They're forming that doctor-patient relationship that we value so strongly as both patients and as eye doctors. But then the patient moves into that retail experience where they're going to ultimately comply with the treatment plans that you prescribe. Well, at that point in time, they're going to go back to making decisions as a consumer. They're going to, yes, we're going to prescribe the right product for them, the right prescription, the right lens, but they're going to want to solve also not only how they see, but the way they look, how they feel about themselves in their glasses or in their contact lenses. And ultimately, I taught there's a philosophical level of decision-making and problem solving. It's how does it help them achieve what they want to achieve in their life, sort of self-actualization from a hierarchy of needs standpoint. So they're making a consumer-based decision. And if we only look at the patient or the individual as one or the other, as 100% patient or in the opposite 100% consumer, then we miss half of that individual who walks through the door. So I use the patient consumer as a term to really recognize the entire individual. And we have to be thinking that they're thinking in both contexts throughout that journey within the practice.
So if I'm hearing you right, almost like there's a paradigm shift at the end of the exam where they move from the medical side to the optical. In the beginning, maybe a paradigm shift from the optical to the medical. You're saying that thinking in terms of a patient consumer might change the way that eye doctors look at their own patients, and how so?
I think it would challenge the way that we, again, on the front end, how do we track them? How do we bring them in? How do we get them to feel good about the care that we're delivering? And no matter where you stand on virtual options, that they're going to want to schedule an appointment with you as a provider and come into the office, take a day off of work or a half day off of work to come in and see you. So if we look at those first steps of the patient customer journey in that context, it's going to change perhaps how we market to them or how we communicate to them in those stages of the journey. And then on the back end of the optical, again, I think it would challenge us how we prescribe the right products to the patients, as well as how our opticians are working with the patient in the optical and styling them and making sure that we're not just, okay, well, this is what the doctor prescribed. Here's a frame that looks good or fits within your insurance. It's get to know the patient a little bit more and the consumer and their needs a little more from a styling standpoint, from a not just lifestyle, but how they feel about themselves, what they want to accomplish, to ultimately make, using that understanding of the patient to ultimately and have them purchase the eyewear or the products that you're prescribing for them.
Well, I've been around a long time. I've seen a lot of organizations that help optometry, and they all bring something different to the table. This is incredibly granular. I'm very impressed with what you and PECAA are bringing on that level, because it's an analysis, and the more you can break it down, the more you can understand it on its most basic primitive level, the more you can build a successful organization on both the retail and the medical side. The independent vertical of our profession has always owned the patient experience. Now, optometry's changed a lot though since I thought about this. Is that still the case?
I think it is still the case, but I don't think that we can sit back on our laurels and just recognize that we own it. As I said earlier, the way that our competition is learning about the patients and about their community and is marketing and reaching out to them. In the consumer context, it's perhaps addressing more of what that consumer might want, and so we're seeing a little more of a shift. So again, I still think that we still own it because we schedule the time to take care of the patient. We're really very good at listening and empathizing with those patients. But again, I think that we can't just sit back and say, okay, yeah, we got that one in the bag. Let's focus on something else. We have to be consciously evaluating who our patients are, how they think, how they operate, to continue to own that patient experience for the future.
So to continue to own that patient experience. I love that. What are some strategies that independents can consider to remain leaders in that experience, the patient experience, that moving forward?
So I think one of the biggest ways that the listeners can own it is always start at the beginning. And I've used the term the patient or customer journey a lot. I would encourage our listeners to take a step back and actually map out the patient customer or patient consumer journey within their practice. And the reality is there isn't just one journey. There's multiple journeys depending upon what the patient is actually stepping into practice for. But start with a comprehensive eye exam. Look at that journey and map it out and recognize, what's the patient thinking? What's the patient feeling at each step of the journey? So again, you start with that awareness phase, and then they know they have an issue and they need to find somebody to take care of them. Then they have, then they reach your website, and that website should be compelling enough to then want them to schedule the patient. By this point in time, schedule an appointment. By this point in time, the patient's already established a first impression of your office, and they haven't even met anybody in the practice yet. So by the time that then you confirm the appointment, you send out some information ahead of time. Again, are you making life easy for the patient? Are they feeling confident before they step foot in the practice? They're like, I'm already overwhelmed and I haven't even met these people yet. Then they step foot in the practice and they're greeted by the front desk and they check in. Well, now that first impression is either completely changed, which that dissonance, good or bad, is not a good thing, or that first impression is just reinforced, again, good or bad. By the time they get to the doctor, they've already established, yep, this is a good thing or this is a bad thing, and I'm not coming back. Well, then finally, then they move through, they have their exam, then they move into the optical, and then they check out. And then there's ongoing communication with the patient, leveraging, your patient communication tools, the data that you have within your EHR and practice management system. It's an ongoing journey that happens throughout the full 12 months. And I'll give it an example in a different context. I started a specialty contact lens practice in Colorado Springs, where I live. And we looked at the experience of specialty contact lens patients, keratocontic patients in particular, and we tried to understand what are the biggest driving factors. And I think it's very easy for us to, say, well, they have keratoconus, they can't see, they need specialty contact lenses. That's the biggest driving factor. What we found is we dove into really just listening and reading what keratocontic patients were saying. Their experience in a lot of practices was not good. They're treated like a burden. The way that they feel about themselves, their self-esteem, their self-actualization is dramatically affected by the fact that they just can't see. They can't see with glasses. They have this degenerative disease. And, when they go in and maybe they're fit in a scleral lens, and the likelihood is they're going to come back for some follow-up visits. And how long does it take them to get their lenses from, first time you order to dispensing to then, making changes? And a lot of the experience of these patients was, I had to wait 2 weeks. I got called that my lenses were in, but then I couldn't get scheduled for another week. That's 7 days of not being able to see. That's 7 days of that personal impact. And again, a lot of their experiences, they were treated like, they felt like they were a burden on the doctor because they kept coming back. And so we created this experience that flipped it on its head, and we treated them like premium IOL or refractive surgery patients. We got them in as soon as possible. We leveraged our team and the technician to do a sort of consultation and walk the patient through everything that they were going to expect. They signed the paperwork, and then we were off to the races with the fitting. We had a special relationship with the lab where we got lenses ordered, made, shipped, delivered within 5 days or less. And as soon as those lenses were in, we guaranteed that the patient would be able to be seen within 24 hours, maybe 48 hours if it was super busy, to have those lenses dispensed. And then we had ongoing communication with them, and we never treated them like a burden. And the experience was so dramatically different. We had patients driving from Denver down to Colorado Springs for their specialty eye care. So again, just an example of how we mapped out the journey, realized how the patient was feeling at each step along the way, and then designed a process that not only met those needs, but it completely exceeded the expectations from an experience standpoint.
Well, you're exceeding my experience because you just answered the next two questions I had for you. So you're really good at this,
Well, thank you.
So for our listeners who want to take a new look at their own patient experience, how can they get started?
So as I said, I think mapping out the patient consumer journey is a great first step, but taking the time to listen to the patients as well. And I'm sure our listeners are going, well, that's my job. I do that every single day. But pay attention into the looks on their face, how they're responding to front desk staff when they're checking in. What are the pain points that they're talking about from an experience standpoint? And at the same time, don't be afraid to ask. ask. You can ask specific questions in a patient survey at the end of you obviously want it to be short and sweet enough that they actually do it, and perhaps leverage technology like their smartphone, your patient communication tools, that they can do it right there in the office. But be asking your patients ask your patients how they feel at each step along the way. Leverage family, leverage friends, people that you trust, that will tell you the good, the bad, and the ugly about their experience in your practice. Have them go through each step, have them take notes, and ask them their opinion and where things could be better, or how things could be changed to make that process more streamlined. One of the things that we always did was the patient, as frequently as we could with the technicians, we didn't let the patient's butt hit the chair for longer than 30 seconds before they were called back. And we had a busy day-to-day schedule. So it's not that we were just sitting in the back twiddling our thumbs, but we had the staffing, we had the processes down that the patient, like I did often, was like, "Well, I didn't fill out any of my paperwork." And you're like, "That's okay. We'll make sure it's all done by the time that you're done." And just that start, again, they've already had a first impression, but that sort of change in what they would expect, because how often are they waiting someplace else? Again, just drove that great experience. So I would start there. The other big critical piece that I don't want our listeners to miss is you have people in your practice that are in their roles in that particular step of the customer journey or the patient journey. They have ideas. They know what's working, what's not working, and don't be afraid to ask them. Leverage the collective wisdom, the collective knowledge, and by asking each team member what's working, what's not working, where are we having problems, how can we fix it, does two things. It makes your life easier as an optometrist, as an owner of a practice, but it empowers your people to provide input. And when you allow them to change the processes, them to own what works and what doesn't work, they feel more empowered. We all know staffing right now is a big headache. How do I keep people? Empowering them and allowing them to influence the way patients experience care is dramatic. And I've always said, the way that I delivered care in every practice setting that I was in has never changed. I always tried to deliver the highest level care and experience per patient. But there was that last practice that I was in, there was one practice where I had way more 5-star Google Yelp reviews than any place else. And honestly, it had nothing to do with me. It had everything to do with each person that touched the patient. I always joke that I was the least important person in the practice, because that first impression, that was driven by the website and the front desk staff, followed by the technician. That lasting impression, that was the front desk checkout staff and the optician. And I was just in the middle making sure the patient got care.
Well, how many 1 and 2 star reviews start out with the doctor was great, but right? That's
there's a lot.
That's exactly what you're talking about. And again, you're a wizard because you covered the next question. So I want to just ask now, how can our audience learn more about PECAA and what you can bring to their practice, what they can do for your independent practice? How can they learn more?
Absolutely. As you said at the beginning, PECAA at this point in time now is the only organization. Yes, we are the largest. We have the size and scale of 12,000 independent eye care professionals, but we also are the only organization that provides both alliance services. We're talking consulting, we're talking community, an annual meeting, deep, strong vendor programs and discounts with key partners that we know are committed to supporting independent eye care, as well as the buying group. We know the majority of members, majority of independents out there belong to 2 or 3 groups. There's at least an alliance group at least one alliance group in there, and at least one buying group in there. So what we offer is a single membership, a single monthly fee that encompasses all of those alliance benefits and that ease, convenience, time savings, and efficiency of consolidated billing and the buying group. So to learn more, any listener can go to PECAA, that's 1 C and 2 A's, PECAA max.com. And from there, you can learn all about the new PECAA Max offering, which is that single monthly fee for everything a practice needs to be successful.
Incredible. That's amazing that this is the first to do this, because those two things are intertwined in so many ways you would think that would happen before, but we're glad you're here now. And thank you, Justin and PECAA, for that, all you bring to independent eye care practitioners, and for the opportunity to talk to you about it tonight. So we appreciate you, and look forward to the next interview where we can talk more about something more, another topic. relevant to independent eye care.
Alan, I appreciate the opportunity to be here and talk about something that I'm incredibly passionate about, and hopefully that got across to the listeners.
Awesome. All right. Take care.